Hello, my name is Aditi. My project is on the effect of dance and DMT on mental health. Mental health forms the bedrock of our overall well-being. Mental health is foundational to the well-being of resilience and facing challenges. Prioritizing mental health is increasingly crucial. Mental illness is prevalent and treatment exploration is ongoing. Simple and easily implementable solutions are vital for improving mental health on a broad scale. Dance shows promise in positively affecting mental health, particularly depression. Dance movement therapy is utilizing dance-based movement as exercise and therapy. It typically involves simple movements choreographed with music. Review findings suggest that dance and dance movement therapy can reduce depression and enhance overall well-being. Both dance and dance movement therapy serve as treatments for mental illness and preventive measures for maintaining mental and physical health. So, introduction. Dance is a rhythmic movement to music, emphasizing personal interpretation and natural response to gravity. Dance classes improve psychological well-being, reducing anxiety and depression while enhancing creativity, motivation, relaxation, and confidence. Dance movement therapy is a holistic therapy using movement to improve mental and physical health, often involving music, flow, exercise, and sensory stimulation. DMT engages patients in a physical and verbal exploration of experiences and can be conducted in individual or group sessions. Various dance forms like DMT offer health benefits and aid healing from physical trauma and diseases such as cancer, heart disease, and depression. Research indicates that dance promotes self-awareness, emotional awareness, and impulse control, bringing positive physical, mental effects for holistic health improvement. Literature review aims to compare the effects of classical dance, dance movement therapy, and traditional sports on mental health on the overall well-being, specifically focusing on anxiety and depression. Methods. I searched Google Scholar and PubMed for peer-reviewed journal articles using search terms dance, mental health, dance movement therapy, well-being, and depression. I screened abstracts of resulting articles, initially selecting about 20 studies. I conducted further screening, narrowing down to 20 studies based on the inclusion criteria. 8 papers were selected from that for the inclusion based on the predefined criteria. The inclusion criteria was established to focus the literature review on the effects of dance and dance movement therapy on mental health. I used the Oxford Center for Evidence-Based Medicine levels of evidence to ensure selected papers were level 3B or above. All selected papers were published in peer-reviewed journals. Experienced dancers in studies had a minimum of 2 years of formal dance training or experience in recognized dance styles, engaging in dance activities for at least 3 hours a week over 12 months. Non-dancers had no formal dance training or experience in recognized dance styles. Subjects representative of DMT expressed interest in participating in DMT as an intervention that had diagnosed mental health condition or reported psychological stress warranting DMT treatment. Selected studies had a sample size of at least 10 participants, and participants in the studies were assessed for anxiety, depression, and stress using surveys. So the results. Dancing is associated with several mental health benefits. So it had improved self-esteem, cognitive stimulation, improvement in anxiety and depression. Dance is a both physically and mentally stimulating activity. So it's exercise, keeping your mind engaged, has music, rhythm. And the review findings indicate that both dance and DMT are really effective in lowering depression, but dance movement therapy is proven to be more effective, but dance is still a good low-cost option. Here's a table with all of my results. So I compared the 8 papers comparing the dance style, frequency, duration, p-value, and number of participants. P-value refers to a confidence interval where if it's less than 0.05, it means the confidence of that result is 95%, meaning there is a less than 5% chance that that result occurred due to chance. So here, all of the p-values are under 0.05, which means the results are confident that they are true and based off of the experiment and not based off chance. So here, this has the frequency and the duration, and overall, the best one from this is paper 5, which had DMT, and it had 75-minute each once-a-week sessions for 20 weeks. Its number of participants, and it has a p-value of less than 0.01. So results more. The table summarized the effects from all 8, and we found that paper 5 had the best outcome because of the lowest p-value, which means it has the highest confidence, and it had the best overall improvement in depression symptoms. So the clinical implications of this, dance can serve as a viable form of treatment. So it can be a low cost, easy to access treatment for a variety of different mental health illnesses, and it's a good source of exercise and mental stimulation. It can be a creative outlet for expression and promote emotional healing. It's also a good preventative measure to maintain both mental and physical health, offering a more proactive approach as well. So this discussion, paper 5 had the greatest statistical significance with the lowest p-value, and it had 20 DMT sessions, 75 minutes each. So based on this overall finding that the more longer sessions and more frequent DMT sessions for a longer period of time contributed to the most statistical significance and the most improvement. And paper 8, one of the other ones, also demonstrated that improvement in somatic symptoms and stress with DMT was also there, showing its effectiveness in treating depression. DMT was also more effective for depression compared to dance. Limitations of all these studies are smaller sample sizes, self-report measures, surveys, shorter follow-up periods, and some of the dancers had all the dance papers needed to have people who had already been dancing, and that part wasn't regulated or controlled, so you don't know how each participant came in to be. Continued research is the best course of action, and doing more research into this field will get the most accurate results on how dance and DMT can best help mental health. Thank you so much for listening to my presentation.